top healthcare professionals in this Commonwealth are extraordinary. And to help me introduce them, I'm going to introduce you again to our chairman, Joseph Feaster Jr., who needs no introduction, has been working tirelessly in this community for a few decades. I can say that to him because it's a few years longer than me, and I'm proud of that, to have someone who has that. But more importantly, I'm proud to have him over to the Urban League. He spent a lot of years at the NAACP and working in other ventures. And about 5 to 7 years ago, he started honing his skills and bringing them over to the Urban League. And we're so proud that he's here with us, working with us in that capacity now. Joseph, why don't you help me introduce our panelists?
Decided to mute myself while you were on, but thank you very much, Dr. Motley. As you can see, you've had an influence on me. I'm wearing a bow tie today to join you and William. So I know what fashion is necessary in order to participate with leaders over lunch for the Urban League. I am so happy to be here today with my colleagues in particularly the not only community hospital with Tom Sands, but with my fellow community health center cohorts, Fredericka Williams and Stan McLaren. I'm a community health center person. Fredericka and I both come from Dimick, having been at Dimick together. I served there for I think 12 years as the chair of the board, but also served on the board for 19 years and also served on Whittier's board for a short period of time. So I'm happy in order to be here. But we have such an exciting program today. It is so current because of the issues that are affecting us locally and throughout our country. So let me get on with the business at hand, because I know we only have an hour in order to do this and a lot to cover. I'm going to introduce our president of the Carney Hospital in terms of Tom Sands. Tom Sands is an accomplished healthcare executive. He has a wealth of direct experience from several sectors of today's healthcare industry. Prior to his post as becoming president of Carney Hospital. Most recently, he served as the senior VP at operations for Northeast Division for Stewart Healthcare, and prior to Navicent Health, a private 637-bed teaching facility in Macon, Georgia, overseeing development and leadership of customer services, diagnostic and therapeutic services, hospitality and support services and operation. Of course, his education is widespread. He's a Morehouse man, having received his Bachelor of Science in Biology from Morehouse, his master's degree in business administration and health administration from Georgia State University, and has received numerous awards, one of which was he was recognized as Professional Achievements Awards by the Institute of Health Administration at Georgia State, and he received the Early Careerist Award and served as the regent for Georgia. But more importantly, as I've worn here at the bottom of my Urban League pin on my lapel, he's a Q. And so I wanted to definitely acknowledge my fellow frat brother in this regard. And Dr. Motley, back to you.
Well, welcome, Tom. But we're also so grateful to have our president and CEO from Whittier Street Health Center, Fredericka Williams. Fredericka, welcome. We're so grateful to have you. You transformed basic community health into a neighborhood centerpiece and a national model at Whittier. Your keen vision has positioned Whittier, and you're such an incredible leader in urban healthcare. You positioned it with a crucial focus on the importance of culturally competent healthcare and social services for all of the populations that are served there. Under your leadership, you've built that incredible building. But what I'm most impressed about is that the board had the vision to name that building in your honor. And so every day you get an opportunity to work into a building with your name on it. and the commitment is right there in front of you. I'm also grateful to know that over 220,000 people visit annually, and that you have learned and continue to do innovative medical and public health services. And so we're so grateful to have you as part of this today. Um, and thank you so much for taking time out of your extraordinary life to be a part of this with us. So thank you and welcome.
Thank you. Well, thank you, and welcome to both Tom Sands and to my dear friend Fredericka Williams. I was so pleased when they did name the building after her. It was most appropriate. I know what she went through to get that building built, and definitely impressed upon the late Mayor Menino to allow her to do that. So I know her strength and her fortitude and her leadership. So I'm happy that she has joined us today. My good friend Stan, I know because in terms of, I'll just say, I'm sure many of the others are as well. He's a good Christian man because he's up with me at Morning Star Baptist Church. He is a church accountant, but more importantly, I saw Stan. Stan originally served on the board of Harvard Street before he ascended to the position of president and CEO. And the board definitely had the foresight and the wise thoughts in order to ask him to serve in that capacity, which he is serving in right now. He comes to Harvard Street with an extensive background of nonprofit and public health organization. As I mentioned, he is an accountant and a distinguished accountant for sure. He's a Dorchester resident for over 30 years. He is passionate, dedicated, and has first-hand knowledge of the community which he serves through Harvard Street. Most notably, he founded back in the day a fatherhood program that continues even to today for low and moderate income families, and assist them in taking part in these fathers taking part in their family's life. Prior to coming to Harvard Street as CEO, he was director of finance and operations for an independent school located in the Grove Hall area. He has worked for a number of nonprofits. He has spearheaded a number of activities. Stan is a warm and inspiring leader who has stepped into the role of president at Harvard Street, and I can't wait to hear what he, Fredericka, and Tom's will add to this conversation today as we discuss a very pressing issue that's affecting our community and our nation.
So they're saying, all right already, man, let's get to this. We already know well, we wanted to hype you all up a little bit because we just wanted people to know how much we appreciate you as individuals, and that you just don't pop up. You worked hard to get where you are, and you're making a tremendous difference. And so we wanted to do something around healthcare in this holiday season, and the fact that so many of us have stayed at home and we've listened to you, we've listened to the appeals, but it gets a little difficult on holidays like Thanksgiving and Kwanzaa and Christmas and Hanukkah and all those things and Three Kings and everything we have to put up with. And so the CDC is telling us, bring the food and don't let nobody else touch it. And they're saying wear a mask while you're preparing food, and that all attendees should store their masks while they're eating and drinking, and that we should limit people coming to our houses and have one person serve all the food and wear a mask, use single options to identify one person to share items, make sure everyone washes their hands for 20 seconds, singing Mary Had a Little Lamb or something. Make sure that your sanitizer has 60% alcohol in it. Designate a space for guests to wash their hands and handle while they're eating food. Limit crowding. And also, they're telling us to do and avoid buffets and drink stations if we can. And so we're coming to you. First of all, we want to start the conversation by just letting folk know a little bit about the entity you lead, but also the services and the care it provides. Then we're going to start linking into all those things we've been hearing. And so I'm going to start with you, Tom. Why don't you tell us a little bit, give us your elevator speech about Carney and what it does.
I look forward to it and happy to do so, Dr. Motley. But first, let me start by thanking you as the urban lead slash, as I'll call you, consultant, president, and leader, and also your chair, Dr. Feister, for your great work and for the honor of inviting me here to participate with the Urban League of Eastern Massachusetts. Carney Hospital, we've been around a long time, since the 1863, when an Irish immigrant named Andrew Carney decided he wanted to do something for immigrants and people who were the blue collar working class community. And so he put his money where his mouth was and started Carney Hospital. So from those humble beginnings, Carney's been around for 150 years serving the community. We continue to serve first and second and third generation immigrants, families, along with the blue collar working class men and women who are out there who are trying to make sure that they can provide livelihood and a future for their family and themselves. And as you were mentioning, why all of us are getting fatigued when it comes to COVID, but let me just tell you one thing that may help you realize that we have to stay diligent. In my hospital right now, we have 7 people in the ICU on ventilators, tubes down their throats because of being exposed to COVID. We have over 20 patients in the entire hospital today that are being served by our staff who are fighting the good fight against COVID. So when it comes to why should we stay diligent, just think of those patients and their families who are today inpatients fighting for their lives and who need us to support them and their families along the way and do the right thing.
President Williams.
Thank you. Thank you, Chancellor Motley, and thank you, Joseph, both of you, for inviting us and for setting up this. The timing is perfect, especially just before Thanksgiving. You've already outlined who we are at Whittier Street Health Center. Like Carney Hospital, we were founded in 1933 with a humble beginnings as a well baby clinic, and we've transformed to this full comprehensive continuum of care that is focused on holistic care. And what we've done, I've been at Whittier since 2002, is to really hone in on our focus around racial and ethnic disparities in healthcare, social justice, and economic equity. Even our partnership with the Urban League, because we recognize that we can talk about the high mortality and morbidity rates in the communities we serve. In Roxbury, a study came out that said the average life expectancy in Roxbury is 59.5 years. Then the Federal Reserve also came out with a report that talks about the average net worth of an average Black person being $8. So you see how those two things impact in health. And we have an obligation to be a beacon of hope in this community, whether it's our Prison to Life program, whether it's our men's health program that Joseph supported many years. We've developed this full continuum of care to address health disparities, social justice, and economic equity. But as I think of my life as a Black woman, as a Black leader, and the transformation that we've gone through, I believe that we've been building the resiliency muscle for this period, for this moment, for this movement, because everything that has happened this year, whether it's the COVID pandemic or the racial unrest, is what we've been preparing for. We don't like that it happened in 2020. So we're saying, be patient. We've invested the time. Let us invest the time this year, because as a people, when we come out of this, we will be better for it. Thank you for the opportunity.
And President McLaren.
Hi, how are you? Like Whittier Street, we began as a well baby clinic also. We are Harvard Street. We're actually located across from Franklin Park, from the Franklin Park Zoo. And we actually have 2 locations. We're located at 895 Blue Hill Ave and 632 Blue Hill Avenue. Our typical patient lives below the poverty line and come from the surrounding communities. They come from Dorchester, Roxbury, Mattapan. However, you'd be surprised to know that we have patients that come from as far north as Lawrence and as far south as Plymouth and Brockton. When patients begin their care with us, they build a solid relationships with our providers. One of our customer service staff who's been here for about 30 years, she knows each of the patients that come here by name. We have a very welcoming environment. We treat anyone coming through our doors with dignity and respect. And I wouldn't have it any other way because I live about 5 minutes from the health center, and many of the patients that we serve are my neighbors. We provide comprehensive services like primary care, dental, eye care, pediatrics. We have an on-site pharmacy. We sign people up for health insurance, WIC, SNAP benefits. And the reason we do all these things is to make it so when you walk through the doors, we're surrounding you with services. And I think we do the same like other health centers for the most part. Community health centers have a legacy of being part of the civil rights movements. And we are part of that, like Fredericka just said, the muscle memory of resilience. We're part of that muscle memory of resilience because we've become a trusted partner with the community. I tell you, what's really been an issue that's been really popping up a lot is issues around mental health. What I'm very proud of is the fact that we are one of 10 health centers in the country that provide a veteran service center. We provide counseling to veterans and provide them with a wide range of social and psychological, along with referral services for the veterans and their families. I think we're going to get through this. I think we have to continue to be resilient. It's extremely important that we remain resilient, and there's another side to this. So I'm glad that we're all gathered here today, and I think with my colleagues, we're here to serve the community.
Well, the statements from the three of you make it quite evident as the reason why we at Urban League have you on this program as our panelists. And I feel the affinity because even with Carney and being a community-based hospital, and my two colleagues at the Community Health Center, where we always talk about the history starting back in 1965 with the creation of the Community Health Center movement. Community health centers were established because they didn't want folks in the hospital, Black and brown folks to be in the hospitals. And the expansive programs that you have developed, each of you have been engaged with lobbying in Washington and at the State House for funding for health centers. Bipartisan wise, we've gotten the support in community health centers and for community hospitals. That being said, in the expansive program, be it your veterans program, Stan, or your men's health program and other expansive programs, I see you had a women's health program you've created as well, Fredericka. I stay on top of what you're doing. COVID has changed the landscape for all three of you. Yes. In the sense of that it's not been a subtraction game, it's been an additional gain for you. And we'll talk about, Stan, the mental health piece, as you know, that's close to my heart later on in the discussion. But I wanted to have you talk about how has COVID impacted your delivery of these great services that you talked about, because you can't see all your patients in there. So the income issue has to be in play in terms of you're trying to get paid by the insurers, et cetera. So I would like for each of you to talk about that. And I'm going to start with my dear friend Fredericka to speak about it first. Then I want to go to you, Tom, and then to you, Stan. And I'll reverse it different times as I begin to question each of you. So Fredericka, how has COVID impacted your ability to provide the services that you have talked about?
Thank you. One of the things that I would say is when you are a trusted partner, we've been preparing for this journey. We continued on. When there was an emergency shutdown, we were open. When a lot of healthcare organizations were closed, we remained open because our patients were being denied access to other hospitals, and we have to be there so that trust will continue beyond the pandemic. So while revenue is important, as Stan said, what is unique to health centers is that we provide care to everyone, regardless of their ability to pay for services. And I also tell people that the health center CEO role is the most challenging because we still in a Commonwealth that has a 98% insured population 36% of our patients are uninsured. We serve a large immigrant population. So we couldn't close the doors. Not only were we open for healthcare and continue to look for ways to make things work, diversify our revenues, look for grant sources, we also launched an emergency daycare because many of our patients and our staff are working parents, and many were now all of a sudden elevated to the status of essential workers. And as a working mother, I know that when my kids were younger, the first thing I thought of every morning I woke up was what I was going to do with my son. So we set up an emergency daycare. Our food pantry was busy. I read a Boston Globe article a couple of weeks ago that talked about Massachusetts having the highest rate of increase in food insecurity. The face of hunger looks different. So what we had to do was, our food pantry was restricted to just our patients. We had to open up to everybody. So we were very creative about community garden, fitness center, and we were also able to pivot very quickly. In April, we launched the on-site COVID testing because we're hearing from our patients that they needed a place to go to, and we've been preparing for this. We launched mobile testing so we can go out in the community to do on-site testing. We have 2 mobile vans that roam the hotspots of the city. In addition, we have a clinic on Blue Hill Ave. So in short, as much as revenue and money is top of mind in every CEO's mind, our mission comes first. We pride ourselves in being a beacon of hope, champions of health equity, and we had to make it work. We had to do some things health-wise for those patients who didn't feel comfortable. Of course, we made sure that we were following CDC guidelines. There were departments we couldn't avoid that had to close. Dental closed, eye care closed, but people's diabetes were still hurting, their hypertension, mental health, as Stan mentioned. So we are resilient, and we are able to pivot very quickly to meet the needs of the community because we want to be an asset in the community. So it's been challenging, but I also believe that every crisis presents an opportunity. The Chinese symbol for crisis is opportunity, and that's how we live our life at Whittier.
Thank you, Fredericka. And Tom, being a community hospital, your role is similar but slightly different in terms of the service provisions that you have. Talk to us about how COVID has impacted the work that you do at Carney Hospital.
COVID has impacted every aspect of life and service that we offer here at Carney. From a hospital perspective, we emergency services, our emergency department that saw over 35,000 patients the year before here at Carney Hospital, people in need, all payer classes, as was mentioned earlier. Even for Carney, over 70% of our patients that we see are what you call public pay, who are part of Mass Health, who are part of Medicare and other public providers, along with the other 30% being a commercial type pay. From a services perspective and how do we impact it, if I can step back for a moment, we historically have offered the general community hospital services of emergency care, inpatient medical care, surgery, but we also have a unique niche in terms of that we have over 50 inpatient behavioral health beds for adolescents, adults, and older adults in the community. So prior to COVID, we were here and serving challenging people who were challenged in life, but making sure that they had the services they need when needed here at our community hospital. Community hospitals are known for having comparable care to those major teaching facilities, having higher patient satisfaction, and doing it at lower costs. So we've always been kind of laser-like focused on being focused on mission, but doing it in an effective, in an operationally effective manner. How did COVID impact us? If I may take a moment, simply because in March of this year, we're part of a larger system of hospitals called Steward Healthcare, 36 hospitals across the United States and 8 in the Commonwealth. In March of this year, seeing that COVID was coming into the United States, the decision was made that in Massachusetts, it would be better if we cohorted the patients in one central hospital. the determination was made that Carney Hospital would be the designated COVID facility, the first one in the United States to have such a designation. So as you might imagine, with that designation came a lot of different feelings from the
Yeah.
community. Why Carney?
Right.
From inside the four walls of the hospital, why Carney? And as the leader of Carney, I, you know, I had to share with everyone, why not Carney?
Mm.
When you look at how people were being impacted, especially people of color, knowing that it was going to be impacting us all, why shouldn't we get ahead of it, be at the tip of the spear to assure that we, the people we're serving, of such a diverse community that we serve, would have that needed healthcare at that time. So what we did was we essentially changed the entire operation of our hospital. We doubled the number of inpatient beds. When you drive by, you will see these windows with little circular tubes coming out the windows. That's called negative pressure rooms. Those negative pressure rooms allowed us to care for our patients in a safe manner, not only for the patients, but also for our employees. We have over 1,100 employees, as Fredericka mentioned, who have, while they were coming in to make sure that they were here to take care of the patients, they also had those concerns about what was going on at home and how could they take care of them. So it was very important to me that we first educate the why we're doing it, but also ensure that the training would be in place so that we could care for the patient safely. That included not only our frontline nurses and physicians, but also our environmental services workers, our food workers, everyone who involved in this operation, who helped ensure that you and our family members were seeing great care. So imagine, I describe it this way. Imagine if you're on an airplane and you double the number of seats, increase the number of crew members that are on the airplane, and bring additional supplies and fuel, and do it all while you're in the air during a hurricane. That's what it was like for us as we converted from being a traditional community hospital to a COVID designated facility. We did that well. I'm so proud of our team. And then as the numbers began to cool down in the summer, we pivoted once again to go back to being open to all, to ensure that not just COVID positive, but people who needed care, we would be here and available for them. So even though the numbers are beginning to increase, we continue to be laser-like focused on providing care to all of the community and doing it in a manner that people feel that is safe, we're ready, and definitely, as Stan mentioned earlier, in a respectful and way where people feel that they're being treated with dignity, and we show compassion to all. So how did COVID change us? It changed us in so many ways, not all negative. The positive way was it brought us together stronger as a team. We had to lean in all together to make sure that we could serve the community the right way. We had to ensure that we had each other's back, recognizing that we were going through stresses that I'm sure we'll talk about along the way. But coming together, communicating, educating, making sure that we had that word called PPE, personal protective equipment, making sure that people had what they needed to serve our patients successfully. That's what COVID meant to us, and what serving this community and being present continues to mean to us as a community hospital.
Well, thank you, Tom, for that. I'm just going to say at this point before I ask Stan to respond to my question is this. With the three of you and Dr. Motley and I had talked about this, we may have to extend the lunch hour, because all the questions that we want asked and what people are going to be asking in there, we may have to do. We may just have to break the rules, but I'm going to leave that to the technical folks to advise us. Or what we're going to do is change the format. We will only allow one to answer a question. It's going to be one or the other. So I'm sure that I don't have anything in my ear, but they'll let me know which way they're going to proceed, whether we extend the lunch hour, because I can tell you, we have a lot to ask you. You have a lot of information to give to our community. So I'll let someone else make the decision as to which one of those we will employ. But at this time, Stan, I'm definitely not going to deny you, my good brother, the opportunity to respond how COVID has affected Harvard Street.
Well, I'm going to say that it's affected all of us, not just Harvard Street. It's affected all my colleagues that are sitting here with us. I don't think there's a blueprint to this. I think it's kind of been something that we've lived through. And I think it's something that, because we're passionate about what we do, we found a way to not only figure out what we needed to do going forward, which, to be honest with you, like Tom said, it is like flying a plane while building it at the same time, because you typically in these positions, we're planning, months and a year and so ahead. In this situation, we were planning day by day because the circumstance just kept changing. This has put a lot of stress on all of our organizations. And I think the biggest thing for me that I got out of this is that not only are the individual organizations working internally as a team because it forced you to be cohesive with your staff, but we're working as a team. The different organizations are working as a team. The different partnerships that are being formed to deal with this issue, because we're in an unprecedented situation. I mean, this hasn't happened since a century or so. And, fortunately, we have the vaccine coming down the pike, but a lot of stuff that's been going on, there's been a lot of uncertainty. And, we've been able to pick up the phone, call our colleagues, to ask questions, to try to figure out, to brainstorm on ways of going forward. And the reason we're doing that is because we are really doing our best to serve the community. I will say we've leaned on trusted partnerships and institutions. Like, for example, we've partnered, like my other colleagues have partnered with the churches, trusted entities in the community. We've partnered with organizations like yours, Urban League, Prince Hall Masons and Grove Hall, Children's Rock Services of Roxbury. I'm just naming a few of the entities that we've partnered with in order to make sure that we're able to provide not only testing, but contact tracing in the community. It is these trusted entities that allowed us to penetrate some of the mistrust that's been developed over the years in the community. We've partnered with the city of Boston. Even though you're seeing what's been going on nationally in some states where there's not cooperation, there's controversy about whether or not people should wear a mask or anything like that. That's not been the case here in Massachusetts. I think both state and locally, there have been a lot of cooperation. Like I said, we've partnered along with my colleagues with the city and the mayor's office in getting resources to expand our testing capacity. We've been doing free testing throughout the community. Each of us have taken on stakes. Like, for example, in my case, we have been, with the city's help, we have expanded to provide testing and housing developments. So it's been a true team effort in my community, in my experience. I think the city has been a great partner in helping us with providing surveillance for this disease. They've also had really a good grassroots marketing piece, because we've been able to let folks know where we're popping up at the different areas to provide testing. So we've reached out in the community. I think all of us have been creative in how we've not only educated the community, but also how we've gone about reaching out. And we've been mobile about it. We talked about being able to pivot, not only in our organizations, but even how we reach out into the community, be able to provide testing in the various area. We've had a robust, in my way, response to all of this. And since this all began, we've found ways, and the board of directors here at Harvard Street has instructed me to find ways to make sure that we have a robust response to this, because our community is disproportionately affected by all of this. So since this all began, we're still treating folks. What we were concerned about was we have a lot of patients, and all of us have patients that have chronic conditions. And those chronic conditions make COVID-19 even more complex. It makes it a situation where it's harder to survive if you contract it. And what we've been able to do is to still try to create a safe environment in our institutions to have our patients physically come in. We have taken advantage of telehealth, but given the chronic conditions of our patients, sometimes they have to be seen. So we've done what we could to retrofit our spaces to make sure that it's a safe environment for our patients to still come in. We've come up with strategies to be able to do that. So this has been a serious impact on the way we provide service. We've had to be extremely creative. And like I said originally, there's no blueprint. We've had to do it step by step and rely on each other to make this thing happen. And I'll end by saying this is a we disease, and the only way we get through this is together.
So I'm not going to let you stop there. I'm going to keep you talking for a minute, Stan. And you mentioned the muscle memory of resilience. But one of the things I want to thank you for, because I was getting all kinds of notes from one community in the neighborhood telling us that we haven't mentioned them at all, and that's our veterans. And so, so grateful that you sort of talked about what you all are doing around veterans today. I know we've been doing, and you talked a little bit about targeted outreach to our communities of color to educate them and to get us all to come in and understand what the risks are. I know I started out half-heartedly joking about how CDC has put all of these kind of recommendations in place. And I wanted to know from your perspective, what you witnessed regarding our behavior as communities of color, and just give us your sort of, your ability to talk to us a little bit about what we should be doing as communities of color around the CDC's recommended health and safety guidelines. I know you mentioned masks. What are the other kinds of things you're recommending to us? And again, we also want to thank you, because the lines were up the street the other day for the testing that we partnered with you.
Yeah.
I know the others are doing similar things, but it was nice to get to Warren Street, and my wife had to turn around. There were so many people in line. So so grateful to you all for that. But anyway, go right ahead.
I'm glad we're in a position to do it. I'm glad, I mean, like I said, there's other health centers that are involved in this also. It's a team approach. Fredericka's out there, Common Square, Dimick. A lot of us are out there making sure that we go about doing this. I think the community needs to know that they have trusted entities that'll be there, not only on this side of it, but on the vaccination side of it. As far as the CDC guidelines are concerned, I said, y'all, we need to follow it. I mean, that's just really that simple. I mean, my office is across from Franklin Park. There's a parking space right out my office. I can look across and I see brothers coming. They gather when this thing began, brothers were hanging out. Nobody was wearing a mask, no mask in sight. And I'll be honest with you, I live 5 minutes from here. And as I drive around the community, I think we've gotten a lot better. We're starting to really wear masks. But, I'm concerned. I think people are getting tired of this. There's a fatigue setting in. Just recently on the news, I heard of I guess they call it a record release party that occurred in Atlanta. My son told me that the rappers were T.I. and Gucci Mane that did this record release party, and there was hundreds of kids hanging out partying with no mask in sight. Now, I mean, we're doing all we can in here, providing education and everything, but that is just sending the wrong message. And I'm concerned that our kids are going to get the impression that about this disease, that it's not that serious. And this disease is very real. It disproportionately affects people of color. We have the highest rates of infection, the highest hospitalization rates, and the highest death rates as a result of this disease. So as a community health center, as a leader, leaders that are on this panel, as a community hospital leader, we're constantly messaging the importance of the 3 W's. That's wear a mask, watch your distance, and wash your hands often. I mean, that's really the bottom line. I mean, we're in the
3 W's.
The 3 W's. Actually, I'm gonna add a 4th one, because I know together, party, and especially during Thanksgiving, everybody's playing spades or whatever. And that's watch your tone, because believe it or not, everyone's sneezing and everything else, and they look at that and start to cover up. But when they start getting loud, or we start laughing loud, that also sets out droplets into the air that's an issue. You know,
So you mean say it, don't spray it is going to a
spray it,
different
right.
level.
You know, I do want to say that we really need to persevere in wearing our masks. I mean, that's very important. I think the CDC guidelines are there for a reason. I think we definitely need to follow them. Personally, I'm celebrating the holidays with immediate family. I mean, when I say that, I'm talking about folks that live with me and I'm around every day. Not my, I have 4 brothers and a sister, and we're not going to hang out this Thanksgiving at all. I'm just dealing with my immediate family. We're going to engage technology to make sure that we connect with extended family members. Our goal and your goal should be to try to make it to next year. Especially as we're looking at a vaccine in next year. In my opinion, that's what we need to do. So yes, during Thanksgiving, I know there are going to be folks that, I mean, we've seen people are testing so that they can go home and everything. So if that's what you're going to do, I think you should follow the DPH guidelines. I think you do need to abide by wearing a mask when you're not eating or drinking. I think you need to wash your hands often, use soap and water, and sing Mary Had a Little Lamb or whatever it is. I think you need to watch your distance. You need to stay at least 6 feet apart as much as you can. If you have, and which most of us do or whatever, have uncles or aunts that are vulnerable or whatever, parents or whatever that are, we need to take extra precautions. You need to be mindful of that during the Thanksgiving, when you're getting together. Just figure out you're not doing that loud talking, you're providing a distance. As much as you can, if you're gathering indoors, you need to be mindful of the ventilation. If you can open windows, please do that. If you can open doors, do that. I mean, that's extremely important. So we need to make sure that you make it to the other side of this. And so those precautions are there to make that happen. So if I have any advice around those CDC guidelines, is make sure it's top of mind as you go through these holidays.
Does anyone else have anything to add to that?
I just have another thought. As Stan mentioned, I'm on the Mayor's Inequities Task Force, and we've been meeting every week. And I will say that speaking to other people in other cities, the city has done a really good job around the messaging and sharing information and really developing a health equity now plan, which is why I said we'll be better for this when we get out of this. But there's also the reality of the community we serve. 82% of our patients live in public housing. So I can go home and socially distance. A lot of our families live in multi-generational homes. So, you know, those are challenges. A lot of, when we started testing children, within a week, there were 30 children that tested positive. And I was curious, and I picked up the phone and wanted to find out, working with our team. And a lot of these children have been raised by their grandparents, living in multi-generational homes. So there are a lot of challenges that our community are addressing, and I don't think people are just being careless. We just need to now say, and this was at a time when wearing masks indoors wasn't recommended. So now we're saying to people, as Stan said, wear masks indoors. The other resistance I've heard is to contact tracing. I know that even some educated people, when it popped up on their iPhone, they thought someone was spying on them. But contact tracing helps us. Testing is good, and I see a lot of people testing. Matter of fact, I see people testing 10, 20 times, but you can test today and not follow the guidelines and catch the virus. And if you do get that phone call from either Harvard Street Contact Tracer or one of our health centers, answer the phone so that we can get that information and get you the care that we need. What we were seeing when the pandemic first broke, we had a 2 to 4% positivity rate in most of the seniors. And now we're seeing about up to 6% some weeks, depending on in the younger population, between the ages of 18 and under 40. My pet peeve is when I see people wearing the mask and it's under their nose. So you're protecting yourself, you're protecting others, but you're not protecting yourself. So, so we hear about the super spreader events. If you're going to wear the mask, please do it properly. socially distanced, but also there's the reality of our community. I've also spoken to patients who are afraid to share the COVID status. There is COVID shaming going on in our community. So we need to continue educating and giving people the tools, because the vaccine is maybe June 2021, somewhere thereabout. So in the meantime, as the CDC director said on CNN the other day, our best bet, better than even a vaccination, is to follow the CDC guidelines.
So, Mr. Chair, I'm going to pivot to you and let you drive us towards some of the next question. And then because we're going to be able to keep filling in the blanks with all these scholars we have on this conversation today.
Well, thank you very much. I'm going to take executive privilege here, since I know all the panelists, and if they tell me no, I will see them post the program. We have so much to cover. We need to extend the time. I hope that you're able to. I know you all have busy schedules, so if you can, does that work for you as well, Mr. President, Dr. Motley, that we extend this?
I would think if they could do 15 minutes, that would be helpful. Is that okay?
Orders, we follow orders. I speak for the rest of my colleagues.
So
We'll
15 minutes.
Great.
Joseph and
whatever the time
minutes.
is.
15 minutes will give us the time to
Okay.
get this framed so that when we send it out all over the country,
yes,
we've covered all the areas and we don't have to hear from other affiliates and from other folk. There are 99 Urban League affiliates, okay? And so your ability to be able to communicate this message all over the country and through all of our networks is amazing for us. So thank you.
Thank
All
you.
right.
Well, in terms of just to be moving it forward, all of you know, in terms of an issue that's near and dear to my heart, and that's the issue of mental health. There was a recent, in September, there was an article that was in the Boston Globe that said Black Americans suffering disproportionately from COVID-19 face a mounting mental health crisis. And in fact, our good Reverend Hammond from Bethel was quoted in that particular article. And I just want to just state some of what was said there. It said the psychological toll inflicted by the coronavirus pandemic is finally becoming clear as new evidence shows symptoms of depression and anxiety have surged since the outbreak disrupted American life this spring. He called it Ray Hammond called it the trifecta of trauma, health, wealth, and stealth crisis. And all of you have talked about the impact of not only the health issue, but also the issues around the fact of what's been happening to Black people and brown people across this country. Stan mentioned, yes, the worst pandemic in 100 years, the worst unemployment in 80 years, and the worst social protests in 60 years. So compounded with all the things that Black and brown people feel, we have the situation you talked about not being able, the multi-generational piece, the issue of people not wanting to recognize that COVID is real, not wearing a mask, etc. The mental health aspects of those are there. Speak to that for us, any one of the panelists. I can't let all three of you talk about it because of the time. Who would like to take that on to talk about what the mental health impact has been as a result of COVID?
Can I just say one quick thing, then I'll hand it over. As we're thinking about the mental health, we're looking at seniors and the social isolation. We're looking at adults. We've established groups. We're worried about the youth. What we are most worried about is we're beginning to see, on average, 1 or 2 kids that are showing up with suicidal ideations. So as parents are struggling, the children are also struggling. So this is, again, so we've set up gender-specific, Afrocentric focused groups, one called Divas and the other one called Bros. We're doing things for our LGBTQ youth because we know as a people of color, as vulnerable as we are, our LGBTQ communities are even more marginalized, and looking at the youth. But you're also looking at a generation of children who are socially isolated. Think of where we were growing up at the stage of our lives where school, a lot of our children got their meals from schools, and now they're home with parents who are experiencing extreme stress. So not only the parents stressed out, but we are concerned about the suicide rate. So, Joseph, mental health, as you know, is something that both of us are passionate about. And I know Stanley too, and Tom as well. And that, believe it or not, during the emergency shutdown is where we began to add more staff. We're also looking at substance abuse. We had to launch opioid prevention program because there were a lot of people that were relapsing. We have DPH is funding a Moms Do Care program, which is also an opioid prevention program. So as people are under stress, it's really impacting the mental health. And the thing that we have to get out is, that's why we do not say mental illness, we say mental health. And because we all, as people, are under extreme stresses, and this pandemic has just exacerbated the sufferings of the community. And that is an area that we need to remove the stigma and build the capacity.
I
Tom.
end up all jumping in on this. I'm going to say I think Fredericka covered it all, to be honest with you. The only thing I'll jump in and say is that what's been interesting this time around is as community health centers, we've been able to utilize telehealth.
Yes.
And that platform, to be quite honest with you, has broken down quite a bit of barriers.
Yes.
Allowed us to kind of reach out into the community a little bit better. It's actually helped to break some of the stigma attached with mental health services, which is, in our community, there's a lot of stigma attached to it because this platform allows us to reach into your homes without you having to come out. And it breaks down the barrier of transportation, and it just allows you to kind of just have a phone conversation with your provider. I am concerned, we talk about where we are now, and you have Fredericka, who's on the Mayor's Health Task Force, myself, who's a co-chair of the Boston Conference of Community Health Centers for the Mass League of Community Health Centers. You have Tom, who's run a community hospital. We really need to advocate that we be able to keep this service beyond, because this has only been authorized. I believe the last authorization, if I'm not mistaken, is through March. And I'm sure they'll push it every 3 months or so. But I think it's extremely important that we advocate for things like this on the other side of, and I say the other side because this pandemic has exposed a lot of all the inequities that were there before, but it's just really exacerbated it. And this is one way of us to break down a barrier so that we can increase access to care. And I think it's been especially successful with regards to mental health services. We've seen a demand for our services, but we've also increased our productivity around being able to meet that demand through using telehealth services. The other piece to telehealth is that typically how it's paid for is because you're able to not only, it's not just telephonic, you're able to go do the video side. Most of our patients, given the poverty level and everything else, they'll only have the telephonic side if they have minutes on their phone. And so we have to advocate that the telephonic side is also paid for on the other side of this. So if I will just add to what Fredericka is saying, I would just speak to the idea that we need to advocate for those platforms or services that's going to allow us to make this mental health services more accessible to our community.
I will just, Fredericka and Stan are right on point with this. From a hospital side, I will say, as you know, before opioid addiction was the big thing people were talking about. You don't hear as much about opioid addiction now, but it's still there. From an inpatient hospital perspective, we have 50 beds dedicated to patients who need inpatient behavioral health. 14 of those beds are designed for adolescents, the teens who are going through trauma and challenges. I just wanted you to know that In the summer, we tend to reduce the number of beds that are available because the kids are able to be with the parents, get out, go to summer camps, don't have as many struggles and challenges, and we don't have as much demand. Our adolescent beds, all 14 beds, were full the entire summer. So
Wow.
totally unexpected. So it's hitting the adults, but also hitting the kids in a major way. We have to be very sensitive to that. And also, as adults, trying to go out there and make a living, as a hospital, we have to make sure that we're reaching out to our employees and making sure they're taking care of themselves. So we've added meditation rooms and mental health support for them, employee assistance programs, so they can stay strong for their families as they come work and take care of their families and their home lives as well.
Back
So,
to you, Dr. Motley.
yeah, so you all have raised this age thing quite a bit today, and it's made me a little sensitive. So I do want to ask some questions around the impact, of age on the spread of COVID. All right, because we've been hearing this thing when all this first evolved, 65 and over. And so if you weren't 65, some people were feeling like everything was cool. Then I know that until the students came back for college, everyone was talking about, well, students are cool and youngsters are cool and it doesn't impact us. But I want to go to our elderly community for a minute because we have lots of members who are part of our guild who are, considered elders right now. And so is the elderly community at greater risk with the Black community and the general population? And what advice related to this do we give to our elders?
Definitely, I would say you are not an elder. You are. I saw Joseph waving his hand. Elder is now defined as 100, so we are all in good company. But anyway, because the older you get, there are underlying health conditions, and that is why you've been hearing the message as much as every one of us. I know I've had several members in my family or extended family who have passed away. So this COVID is real. And some of them were in their 60s and some were in their 50s as well. So, but if you have underlying health conditions, it puts you at higher risk. That is why the message we are getting, and I mentioned the intergenerational homes. So if you live at home with your grandmother and you go out to a super spreader event, you are putting not only yourself at risk, but the people that you live at home at risk. And that's why you hear Dr. Fauci and everybody saying, think of yourself, but also think of the people that you're exposing. We have seen that when we first started testing, the elderly were testing positive, but also when we reopened, and while telehealth is good, there's some, level of in-person care that's good because we've had to implement diabetes medical group visits, hypertension groups, because when we started reopening and letting more people in the building, our medical director, Dr. Wright, and the clinical team were, really concerned about how people's health have deteriorated. So as much as we are worried about the COVID, it has also been stated that COVID ongoing, the impact, neurological impact and the health impact is going to continue being an underlying health condition for those who've had it. So it's really, they are at risk. We should not put them at risk. We should do everything to support them and follow the guidelines. So.
I think what's extremely important in what Fredericka just said is that, when you turn the news on, they're always highlighting the deaths. But what's going to be significant going forward are those that actually survive COVID and have these underlying conditions to deal with. With regards to older, I noticed when it was said, everyone kind of stepped back, like part of that. But you need to know that, as your age increases, you're at greater risk with regards to this disease. I mean, there's just nowhere around that. I think, I've been saying from day one, the 3 W's, actually with me, it's 4 W's, right? That we need to be very vigilant about that. I think one of the things that we need, you know, as far as older folks need to consider is that we need to do some better planning also. Just an example to throw out, like if you can't get somebody, especially, you know, if you're really up there, if you can't get anyone like to shop for you or whatever, maybe you should plan to try to go early when not as many people are in the supermarket. I think things like that would be helpful, but definitely this affects the older population, and this affects people with underlying conditions. And I mean, it's just unfortunate. So we're looking at elderly and unfortunately with people of color because we've been marginalized historically, and we tend to have a greater proportion of underlying conditions. So I think it's important to just continue to point to the fact that we need to stay vigilant. We need to follow the CDC guidelines, and we need to do some planning. Better planning is how we plan out our day and how we interact in society.
Once again, right on point comments. I would say that we have to help out everyone be successful and be in a position to thrive in this pandemic. My mother's in her 80s. We're from Georgia. You mentioned Atlanta earlier. Typically, we have 50 or 60 people who are going to be gathering for Thanksgiving. We're not going to do that this year. I would say we're fortunate to be in a position where I could purchase my mother an iPhone. So we're going to have a FaceTime Thanksgiving that we can participate in to keep her safe. Once I show her how to stop having the screen pointing up to the ceiling when I'm speaking to her, so I can actually see her face, we'll share those things. But you know, we have to do this. You know, Stan talked about the W's. Fredericka talked about some of the challenges in these multi-generational homes. But what I would simply say is why we should do it, why we should do it for ourselves, regardless of our age. It's about love for ourselves and love for each other. And so I think that love factor should be what drives us forward to do the right thing, to support each other as we persevere through this pandemic.
Love, love, love.
Well, as we move towards the close of the program, I'm going to ask one more question. I wanted to let the young folks on here know that no, we don't play spades, we don't play hearts, we play whist and pinochle. And clearly, I can assure you that the way I played with my family, I would have to wear a double mask because all the trash that we would be talking during the card game. So Stan, that's what we'd have to do, or either forego the game. But we talked about all of the things that we should be doing, the 4 W's and all of that in the interim. There's much discussion about a vaccine. And I know, Fredericka, you mentioned that as far as the time frame, maybe next June or whatever. What is your sense? I mean, right now the hype is that there's 90% good and there's 95% good. Quickly, if you all would talk about what your sense is about a vaccine, because there are a lot of people, young and old, that are out there who are saying, oh, relief is right around the corner. And I don't believe that is so. So please enlighten our viewing audience.
Do you want me to go with that first? You know, and I think some of this stuff needs to be placed in the context of history. With regards to vaccines, when you think about the Black community, you start to think about things like the Tuskegee Airmen and what happened back then. I think that the entities that you have here, my colleagues, are going to have to be on the forefront of delivering of this vaccine, only because I think there's going to have to be a trust element to this. We're also going to have to do some serious education with regard to this. I'll quote, there's this saying, I have it on my email, I have it all over the place. Martin Luther King once said that we are caught in an inescapable network of mutuality, tied in a single garment of destiny. What that means basically is that injustice anywhere is a threat to justice everywhere. And whatever affects one directly affects all indirectly. I said earlier, this is a we disease, and the only way we get through this is together. However, even though this delivery of the vaccine, in my opinion, cannot promote racial division, I do believe the distribution strategy needs to consider those that are being disproportionately affected by the disease. You know, I mentioned I was a co-chair for the Boston Conference of Health Centers. Fredericka is on the Mayor's Health Task Force. I think we're bringing that to the forefront in the conversation when it comes to strategy around distribution. You know, I'll be advocating so that we consider this issue when it comes to the delivery on this vaccine. I'm sure my colleagues will be doing the same. I think there's going to have to be a lot of development of trust. I think over the next few months, that's going to be our charge to get out there in the community and advocate. Of course, we're paying attention to what's going on nationally around this. We're paying attention to the science around it. We're just trying to make sure that we're at the table when these discussions are being had, so that we make sure that our community is not being held, you know, that we're not just looking at this as, okay, we're just going to hand it out and not think about how this disease is affecting people as a whole or our community as a whole, that we consider this as we distribute the vaccine. So, I mean, that's kind of my 2 cents on this.
The only other thing that I would add is all of you know that it takes decades to develop vaccinations. And for COVID-19, within a 10-month period, we have Moderna and Pfizer saying that their vaccines have a 95% efficacy. And then I saw AstraZeneca this morning talking about a 70% efficacy. And I think what we are working on with the city and DPH as well, as Stanley said, is we have the historical suspicion. When you look at the trials, and that's what I've been raising at the Mayor's Task Force, when you look at the trials, it wasn't transparent who these 95% efficacy or 70% efficacy, who were in the clinical trials. I will be honest that there were a couple of hospitals that reached out to us as we were in the midst of the crisis, looking to send patients to participate in trials and to give them a stipend. And I felt that as a leader, I would not participate in the trials at that time, and I would not recommend something that I wouldn't do for myself. We have a lot more information now, and the challenge for us as healthcare leaders, the challenge for the Department of Public Health, the Boston Public Health Commission, is to do the messaging and education that will empower people to feel comfortable, because there wasn't a lot of transparency around the trials, and all of a sudden we're hearing all of these numbers. So we are trying to get educated, whether it's through the Mass League of Community Health Centers, the Boston Conference, to make sure that when we communicate to our patients, the messaging is culturally appropriate and we're sharing the right information. So it is going to be a while for us to get there, but all of us have already put in our requests for who our most vulnerable are. And looking at the criteria that has been established, it seems priority would be given to those who have been categorized as the most vulnerable. So hopefully with our collected voices, we'll be shouting loud to make sure that we are that priority, but that our patients have the information.
Yes, I'll simply say that we are preparing to be able to distribute the vaccine. We're on numerous calls on a weekly basis now in preparation. As mentioned, as these drugs and vaccines become available, they're coming behind a history of distrust. You know, we talked about the Tuskegee experiment, but even in terms of the anti-vaccine people who've been, you know, kind of around over the past several years, who not getting the basic inoculations in place. So for us and all of us, it has to be about being at the table, number one, to make sure that our voices are heard and not just being told. We will bring our expertise and experience to the table as part of being at the table with the discussion. Education, doing a quarantine COVID world is going to be even more challenging as we get the word out. And then just making sure we communicate the why and being in a position to say, yes, this is the right thing to do. Leading by example, to be honest, I think, as healthcare leaders, we're probably going to be, we can't just talk about it. We're going to be the ones that got to step up and get the inoculation to show that that trust is there. That goes with the seat. And so we must be willing to step up. And by stepping up, that shows people that we lead that we feel it is safe and it is the right thing to do. So I feel as leaders, we will have to be part of that first generation group that moves forward with the inoculation, because we're going to need a safe one that we trust and leadership by example.
Well, we feel safe having you in the leadership that you're all in this city and beyond. We want to thank you. And to those of you that have been asking, yes, this will be available on websites and all over the place for you after the show, and we're going to distribute it because we know that some of you were able to be here live, but there are lots of people who weren't and need to hear this story. Thanks to our extraordinary panel of health professionals, Tom Sands of Carney Hospital, Fredericka Williams of Whittier Street Health Center, and Stan McLaren of Harvard Street Health Center, and also to our co-host and chairman, Joseph Feaster Jr. Thank you as well. I want to thank you as an audience for tuning in, and look out for our next Leader Over Lunch that we're going to be doing very soon. And also make sure that you have an incredible Thanksgiving. But I want to remind you, December 16th, we're going to feature former president and CEO of the Urban League of Eastern Massachusetts, Dr. Joan Wallace Benjamin, and her new book, Leading a Life in Balance. You can become a member of the Urban League. Visit our website, www.ulem.org for more details. And for more info, at ulem.org. Thank you for coming out this afternoon. Thank you to our extraordinary leaders. Everyone have a great Thanksgiving, a great day. Stay safe, stay healthy, stay strong. Thank you.
Thank you. Thank you. Happy Thanksgiving to everyone.
All right.
Bye.
Take